Remember I said there might be something else going on with your baby when you hear them making these little grunting sounds, whether in their sleep or when they're awake? It sounds something like this. That's the sound that a baby younger than about 12 weeks will make when a bubble of air is trapped in their stomach and they are trying to get it to come up as a burp. This can happen after a feed, especially if your baby tends to swallow quite a lot of air while drinking. It can happen during a feed if they happen to take a big gulp of air, and sometimes, rather confusingly, it can happen before a feed and they will need to burp first before you try to latch them. A baby with a bubble in their stomach often struggles to latch, as this is something that's quite painful to deal with. Many adults are rushed to the ER thinking that they are having a heart attack or a gall attack when all they really had was a bubble trapped in their stomach. The stretch receptors in our esophagus, stomach, and intestines are extremely sensitive, and strangely enough, our intestines don't feel anything when they are cut or burned, but being stretched is not their jam. They hate that. Helping your baby to burp properly doesn't always sound that important, but it really is. I recently had a client who had unwittingly created quite a severe breastfeeding aversion in her 7-week-old baby because she was so afraid that he wasn't getting enough milk that she would offer the breast every time he cried, no matter what the cry sounded like. He was gaining weight well. She had no reason to believe that she didn't have enough milk or that he was being starved, but she'd been told so many times by her family members and her doctor that she probably wouldn't make enough milk that it was like a deeply embedded fear by the time she came to me. Her baby was flatly refusing to latch at the breast, but was able to bottle feed, and she found that pumping wasn't nearly as effective as him latching, so she was struggling to keep up her milk supply. We chatted via video, because that way I can see and hear what is happening, and I find that to be the most effective with newborns. And this poor baby would loudly say, "eh!" And I said, "Oh yes, that's a very clear sound that means he needs to burp before you feed him." So she would make this very half-hearted attempt to kind of sit him upright and pat him a bit, but after 3 seconds she would become anxious that he was hungry and she would try to latch him. So then he would turn his face away and fairly shriek in frustration. And unfortunately, I wasn't able to help her at the end of the day because she refused to try to burp him properly, and I couldn't force her to try for longer or convince her that the baby wasn't going to starve if she took 1 minute more to make him more comfortable before latching him. If you'd like to learn the other 4 newborn cries, please go take a look at my free content on my TikTok profile. Here in my bio are these gray tabs, which can slide to the left, and then you'll find this one, Secret Newborn Language. Tapping on that tab will open all the videos in that playlist one after another. Learning what the different newborn cries mean is a life-changing process, and it's actually much quicker and easier than you would think. So how do we tell the difference between needing to burp and needing the toilet in our babies? Needing the toilet will have a more guttural sound to it as abdominal effort is being added. Anytime you hear your baby sounding a little bit angry, they're not angry, they're probably just tightening their abdominal muscles trying to help themselves. Needing to burp is usually a shorter sound, just eh, with less abdominal effort added. Babies do sometimes grumble the sound in their sleep, like this. And if you notice that, you can often get a good burp out of them without even waking them too much, just by holding them upright, resting their face in your hand, and pushing gently on the small of their back with your other hand. Straightening them up this way will often let them burp and go straight back to sleep. If you have a tense, hypertonic baby who has been lifting their head since birth and standing in your lap and doing a plank maneuver over your shoulder, you may need to do some considerable effort to help them relax their muscles enough to let go of the air bubbles. There's an excellent colic masterclass at the link in my bio offered by a chiropractor with decades of experience helping newborns to relax, stretch out, and make more space for their organs. If you find your baby is very tense and gassy, you should definitely check that out. So there can obviously be other reasons why babies cry at night, but normally the grumbling, straining, grunting little episodes that they do is simply that they need to burp or that they need to go to the toilet or release some gases from their body. I'm so glad that you've watched this far and that you have had a little introduction into elimination communication and how the rest of the world raises their babies with a very different attitude and a very different level of trust and bonding between them and their babies. I raised my baby in this way, and she never had to be potty trained. We simply went from doing everything for her to her being able to do more and more of it herself as time went on. So as they get bigger and older and more skilled, they start developing skills such as pulling the pants up and down, wiping by themselves, flushing the toilet, washing their own hands. And these things don't need to be rushed. This is just a different way of raising a baby that 80% of the world's population uses. And I'm so glad that you've had a little bit of exposure to it, because I believe every Western parent needs to know that they are living in a world that has been created for them largely by giant corporations that are making money out of them. And until about the 1940s or 50s in the United States, it was very normal for babies to be fully potty trained by the age of 18 months. And then in about the 1990s, that age was raised up to about 3 years old, 3.3 years. So things have changed, but we can go back to the way that works really well for us anytime we like.